All right, keeping with your health news now, a major new development in the fight against COVID-19. We are one step closer to a COVID vaccine for our youngest kids 6 years old and younger. So let's take a look at the latest. Moderna is asking the FDA for an emergency use authorization for their 2-dose COVID-19 vaccine. Now, it would be available for kids between the ages of 6 months and 6 years old. So far, those kids have had no protection. COVID cases among kids under 17 are actually on the rise, up 43% from 2 weeks ago. Very scary number when you look at that. And CBS contributor Dr. David Agus says that parents should not hesitate to get their young kids vaccinated as soon as it's available.
What we know is that there are hundreds of hospitalizations over the last several months in these kids, and long COVID can happen in significantly more children. So I am a believer that you need to get the vaccine to get enough immunity to protect yourself against these, especially as the virus continues to change. We're seeing new variants pop up. Now we have BA.2.1.2.12.1. All of these new variants are certainly more infectious and causing problems. So protect the children, please. Give them the ability so they're not going to get seriously ill or have long COVID.
Well, studies found that 2 doses of the Moderna vaccine have a 51% efficacy rate for kids 6 months to 2 years old and 37% rate for kids 2 to under 6 years old. So something to think about for parents once that becomes available. And according to a new report from the CDC, 3 out of every 4 U.S. children has in fact had the coronavirus, and more than half of all Americans have signs of previous infection. The researchers examined blood samples from more than 200,000 Americans and looked for virus-fighting antibodies made from infections. They found that signs of past infection rose dramatically between December and February when the more contagious Omicron variant really surged here in the United States.